Welcome back to Inspire Great Health. We have some exciting news. Our emergency department was recently awarded the Emergency Nurses Association Lantern Award, and we have some folks here today who are going to tell us a little bit more about what that means. So I welcome back Jared. How are you today?
Fantastic. Thank you for having me.
Thank you for coming back. Go ahead and just kind of catch people up again on what your title is.
My title is Trauma Emergency and Logistics Administrator.
Well, welcome back. So good to have you again.
Absolutely.
And Jennifer, go ahead and introduce yourself.
Hi, my name is Jennifer Villarreal, and I am the clinical manager for the emergency department.
Well, so glad you could join us today as well.
Thank you.
So let's talk more about this award. So it's from the Emergency Nurses Association, and it's a Lantern Award. Tell us more about what that means.
So the Lantern Award is a national recognition from the Emergency Nurses Association, or the ENA, who recognizes hospitals who demonstrate outstanding care and service and who have innovation and advocacy for patients. And it's really important to us because we are the first hospital within Wyoming to receive this recognition from the ENA. So I think it talks really great volumes about our department, the care that we provide, and the communities that we serve.
So what does this award say about what patients, the type of care that patients can expect to receive in the emergency department?
Yeah, I think the first thing it really demonstrates is that the care they're getting is evidence-based and cutting-edge care. So it means that the care that you're receiving in Cheyenne and the care that our emergency physicians and nurses and techs are all providing is equivalent and as good as any care that's being done across our nation in terms of regardless of whether you're in an inner city, a large metropolitan area, or a rural hospital. The emergency care here is top-notch. It's evidence-based and has but the same kind of outcomes that you would expect anywhere.
And evidence-based, that just means it's been scientifically proven.
Absolutely, yeah. So this is care that's been either researched, written up in journals, researched by the American College of Emergency Physicians or the Emergency Nurses Association. All of these different types of specific care that you would get has been researched and is in practice across our nation.
So how does the ENA evaluate hospitals and medical systems when they're researching who has earned this award?
So the ENA looks at a really broad spectrum of things. So they look at whether your emergency department is innovative. They look at how well you treat your staff, how well your staff are satisfied with their jobs. They look at your outcomes across a variety of metrics. They look if you're trying to improve outcomes. They look at the type of leaders that your department has. And it puts all of those things together to see if you have the full scope. So you can't just be excelling in one area and say that, oh, my staff are happy, but you don't have great outcomes. You have to be meeting all of these metrics. So, you have to be doing process improvement work. You have to be leading and innovating in ways that not everybody is doing. We had to demonstrate across a variety of different criteria to that we were evaluated on.
So what part does teamwork play in earning an award like this?
I think that teamwork is absolutely essential to win this award. It didn't come from us submitting the application. It came from the work that's done every single day by the staff at bedside. And that is from our providers to our nurses and our ED techs, to our medics, to ancillary staff who are assisting in meeting our metrics and our goals. And then our patient experience side as well, right? And that goes back into having a good culture and being able to be there for one another to be able to provide the best care that we can for our patients. So I think it's a full collaborative effect that we've been able to achieve this.
What makes you most proud of your staff and yourselves when you think about this award?
I would say what makes me most proud of this award is how far our department has come over the last several years. We have evolved in leadership roles, we've evolved within our new staff, we've entered into a new residency program to where we can develop critical thinking within these nurses, which is part of how they're able to do so well today. And so when I think of our team and being recognized on such a national level within our state, I don't think we could be more proud of them and their willingness to come in and take care of our patients every day.
Now, this is a big award for any hospital, but why is it so meaningful for a rural hospital?
I mean, I think in the state of Wyoming, I mean, you have different levels of rural. So we're fortunate to have a lot of resources in our community. But nonetheless, when you compare us to a larger city, a level one trauma center, university style hospital, where you would expect that they have all of the things in place, every resource that you could imagine, it really demonstrates to, obviously our county, but also our region and our critical access hospitals that we serve around our region, that everyone in this area understands and can be very confident that the same kind of outcomes, the same care are being delivered in Cheyenne. So, all of our community members know that if they have an emergency, that they're going to get that same quality of care, have the same kind of outcomes that they would get in any city across our nation. And all of the people that perhaps have to come to Cheyenne from outside areas, that they can be confident they're going to receive that care. So it allows us to serve as a true regional center for our state and our region, and be providing exceptional emergency care.
Now, how do you keep up the momentum after getting an award like this? So your team they're working hard. How do you just keep moving forward after this?
Yeah, I think this is a wonderful accolade and a great way to stop and pause and enjoy the fact that we have that recognition. But all of us in the emergency department, our physicians, our staff, and all of us as leaders are really focused more on who we are, what our mission and vision is for our community, and who we want to be for our community and the people that we're serving. So this is more just a checkpoint along the way. It's nice to stop and celebrate this win and this achievement and accept that validation from somewhere else, an outside source. But really, we're here because we are dedicated and we are on a mission to be the best emergency department in our region for sure and across our country. And so that doesn't stop here today. We're continuing with that. We're always going to be looking at ways that we can make things better for the people that work in our department and for our community members.
So now, are there any goals moving forward for the emergency department?
Yeah, absolutely. I mean, we have goals all the time, right? So, I mean, patient safety is obviously our high priority. So we are always concerned about making sure that we're evaluating on a daily basis where things could be, where we have opportunities to continue to improve, to ensure that we're having the best possible outcomes for every single patient that comes into our department. Right now, we're also very focused on our throughput. So we're continuing to look at ways to ensure that patients that come to our department are seen efficiently, seen immediately by a provider, and can have not only great care, but efficient care as they come through our department. And we're also very focused on our patient experience. We recognize that obviously, first we keep everyone safe, but we also really care about how we make you feel. And so we want everyone to come to our department and have a great experience across the continuum.
Is there anything else you'd like to add?
Yeah, I think this is just a real testament to the dedication of our team is my big thing. Like, this is not an award for the hospital in itself, but truly for the team members that are there doing the work every day and taking care of our patients and our community. And they're just an amazing team, an amazing group of people, and they deserve all the accolades they receive.
I would agree with that. You guys are amazing. Everything you guys do over at the emergency department is just awesome in my eyes. So thank you for joining me today and explaining to me a little bit more about this award and what all you've done to achieve it.
Thank you.
Thank you.
Thanks.
And thank you for tuning in. Be sure to tune in again next time, and we're going to be talking about preventive care.